Ronnie's been.
Where?
Yesterday, Ronnie told me he had been in the office. Yeah, because I heard the story, and then he used his phone. He literally came to do live streaming, and like he made an effort. I mean, what I ended up doing is tying in like the suburbs doing their emergency orders with what was here, because Mayor Harris was here, and he talked about that mostly anyway. So I like tied those in. Ronnie like went around and introduced himself to like Mayor Harris and Dr. Haushalter and like to.
Just FYI, we're actually live now.
Oh.
Just letting you know.
But fortunately, Josh
Oh, I didn't know he was a chief.
Yeah, Scott.
Yeah, that's been a while.
And he understands that what I normally do is
Wanted to make sure he.
day-to-day.
Yeah. Yeah. Right. He has questions for me too about testing, because that's his big thing. Did you even build this? No, I don't.
It's been around a long time. Oh my gosh, it's
Yeah. Someone messaged me and was like, how many tests have you done? I was like, great question. I was like, there's a better idea.
Because like the chills and the shakes and like that's like when you know. Yeah, like so your whole body is aching.
Right.
added to my use of
Right.
it was like,
Right.
yeah, it's great.
Pneumonia, you kind of you feel like run down.
They want to have that idea.
I like walking.
Like it's right. Right. For them, it's about like.
Hopefully, that will go
How long
on.
you been?
I think I was out with the Saturdays, because I just flew earlier that year. I was
Yeah.
here last year.
Yeah.
Now we got.
Struggle was real.
Could be a while. So then,
You think about.
yeah, I literally took a day off to go to the hospital. Yeah. And went back to work the next day. And I was just kind of like, that's my surgery straight. And then they're like, you can go home. Okay. Like, the ones are good.
That was like the day certain members of the media after a good just a little concert. They said, "Oh, we didn't have alcohol."
Yeah.
That's like.
There was a certain someone they call that sick, and I heard about it. Certain someone who was posting social media pictures the night before. You were, or she was.
I heard she was great though.
She was that
That was,
I don't know a number.
when I got pneumonia, I had alpha.
Oh.
You're not live, are you?
I went out. Oh, that's,
And that was the farewell tour.
yeah, I know.
Imagine all that.
And it was really, really.
It's been a bad year.
It was, and then now we're in 2020, so.
Well, I was.
It's been a bad year. It's
Well,
continuing.
next Thursday, next Thursday, I was supposed to be at Bridgestone Arena to see Pearl Jam. That got postponed.
Did they just postpone it?
Yeah, they just.
They already, I heard they've already postponed James Taylor too.
I haven't heard.
I mean, maybe till September. Everything's till September.
The question would be like with the
I
NBA.
mean, this fall is going to be so damn busy.
I know, but we're all gonna love it.
Well, in the end, I want that. I want that.
We're gonna embrace it because we've been like.
I'm going to go out to eat every day.
I just live on a patio. For later, yeah. I know, like.
get my interpreter in the frame, please. Good afternoon, everyone. We are going to strive to adhere to social distancing as best we can until Joan finds a solution to this space. So I appreciate everyone spreading out. And today, our announcement is that we have 135 cases of confirmed COVID-19 in our community. Within Tennessee, there are 615, and it remains that the majority of those are in the Middle Tennessee area between Davidson, Williamson, Rutherford County areas. We are also monitoring the surrounding counties, including Tipton, which still has a small number, DeSoto County, which their numbers are rising as well, and then Crittenden County. A few things that I wanted to just highlight today, because I know we've been getting questions, and we try to make sure we're responsive to the questions that we receive. There will still be a discrepancy between our numbers and the state for a little while, and that's a result of the commercial labs coming on and their timeliness or lack thereof reporting to both the state and the local health department. So it's a law that a healthcare provider and or a laboratory has to report immediately to the local health authority if they have a positive notifiable disease. So we receive some labs, and there may be a little delay in the state, but the state is working diligently to reduce that delay. And then we set these meetings up at 2 o'clock in the very beginning because that worked for everybody, but that also creates a time discrepancy between my report and the state. So we may also look at changing the time so that we're clearer on the data being similar. I'm confident that there's not a discrepancy. It's just really a lag in the reporting that becomes more of a challenge. And as you all are aware, yesterday Mayor Harris announced that he would be issuing an executive order, a stay-at-home order for the unincorporated areas, and that the other mayors would be issuing a similar order. That is really important because it does bring the efforts to a geographic and population scale to make a difference, and that's really important. I know there are efforts underway to connect with the other counties so that they're doing the same thing at the same time. And then as the health director and in partnership with our health officer, Dr. Bruce Randolph, we will be issuing shortly a public health directive, which covers the whole county and mirrors the language of the executive orders. That just strengthens the orders, and they're all consistent. But again, it does bring it to scale. I want to reinforce, though, that there are multiple levels that we need to change within our community to be able to reduce the transmission. And as on my way in here, I was listening to people in Italy and what they're experiencing. And so our goal locally is to be aggressive enough that we don't end up like Italy or Spain, and to try to really reduce transmission early on. The community-based orders, the stay-at-home orders, are going to have significant impact. And what people do in the workplace is also going to have significant impact. So I will reinforce what I've said for some days now. It's really critical that individuals who are ill do not go into the workplace, and that it's more important that employers assure that they have employees that are not ill in the workplace. So that if someone comes to work and they're ill with fever, cough, or so on, they should be sent home and not be allowed to be in the workplace. And then at the individual level, we all have quite a bit to do. Many people are beginning to wear masks. Masks are recommended for people who have chronic illnesses or maybe even seniors. And I generally say make that decision in partnership with your physician. But that is not the only thing that people need to do. We've stressed a lot about the importance of hand washing. Hand washing is always the first barrier to getting sick, and so I want to reinforce the importance of hand washing and not touching one's face and not touching a lot of hard surfaces and keeping those clean. That's going to be critical as well. We do anticipate the numbers will continue to grow until we see a peak, and then they'll start to come down. There is a joint task force between the city and the county, and it includes other municipalities, and so collectively, we're all looking at what are the options we need to exercise to continue to reduce the impact in our community and to begin to predict what impact we may have on healthcare and hospital systems. So I'm going to pause there and then open it up for questions.
How many people are hospitalized right now?
So the hospital data we do not have daily. We may get it when a person is initially referred to us, but the number has been relatively small out of that 135. And one of the things that we're doing is, as you know, this started before there was a lot of epidemiological processes in place for data collection. So our Epi team is working diligently with the state to be able to capture that data and provide it more real time. It'll probably be another week or so before we can do that consistently and accurately. We want to make sure we have accurate data.
Can you tell us when the private lab information will dovetail in with what you know so that we can begin reporting how many people have been tested?
So what the law requires, again, is only to report what is positive. That's going to be further complicated because nationwide they're saying that people will be able to do self-testing within the week. And those then can be dropped off at a lab. And we will have to get those reports. So I think it's fair to say that we're going to continue to have some ups and downs in reporting what tests were done or number of tests and the number of positive. What I've said all along is the positive ones are what's critical. We know we have 135 cases and that number is going up and that's what's important.
Do you expect to know how many tests were done, though, in the future?
Well, that's the goal, but again, there's no law that requires a lab to report how many tests they ran. They only have to report what they had that was a positive result. So as more labs get on board, they're not in any way forced to comply to any regulation to report.
Last week you said there were 41 labs. Is that in Shelby County or statewide?
I didn't report there were 41. The state may have had that listed. There's a multitude of labs across the state that are doing things, and there are a variety of labs running locally.
Dr. Household, these safer home orders take effect at 6 o'clock tonight.
Yes.
For people out there who, this will obviously impact their lives in some way, what would be your message to the community and the importance of following this and helping contain this spread?
It really is about balancing our social and economic freedoms and our desire to be independent with thinking about others in addition to ourselves. And again, listening to stories from other countries where they've had mass deaths as a result, I think will lead us to recognize that we all can take action that is not going to just help us individually and our families, but our community at large. It will be challenging, but I trust that as people rally together and we come together, we're going to make a difference together.
And can you talk about the testing, kind of a two-pronged question here? One would be the Tiger Lane. I know the mayor and other folks said yesterday there was a run-through of some first responders. They were hopeful that that could be up and running by the end of this week, subject to test availability. And then also on testing that rapid response test, I know some of the hospitals here say that they are already on the wait list for that. Is that test that the FDA recently approved, is that in this mix too? Kind of all sorts of testing issues.
So let's start with that one and work up. That's in the mix, but we're not getting results from those tests yet because they are still in a pilot stage. But ideally, that'll increase not only the number of tests run, but how quickly you get a result. So if somebody is tested, they're actually instructed to remain isolated till that test result comes back. And we know when we did some calculations early on that only about 3% of our tests were positive. 97% were negative. That means a significant number of people had to remain at home for the 3 to 5 days for that result to come back. So the rapid test will mean immediately in the provider's office and you can take appropriate action.
Okay, just for clarity, the 6 o'clock, of course, stay-at-home order goes into effect this evening.
Yes.
Who is exempt? Just first responders and medical people?
No, and I didn't bring the full list, but we'll post it on the website. It's, again, it's consistent across jurisdictions. It's anyone who does essential work. And so that would be healthcare providers, including researchers, first responders, EMS, public health professionals, somebody who actually has a grocery store, because people need to buy groceries, those kinds of things, but we'll publish the full list. And I don't think I answered
Yeah, I was
your
gonna
other
say.
question. I was trying to come
You're gonna
back to
read
it,
it.
so they got me off track. Ask me again.
The Tiger Lane testing, I know that there was some testing of first responders done. The mayor and others had said hopefully by the end of this week, subject to testing availability. What's the latest on?
So that's the same update I had. The task force meets every morning at 8, and the report out was that they were still working on the workflow and the throughput there. I understand that the predicted bad weather was going to make them have a shorter day today, but they're still hoping to be ready to go by the end of the week.
What's your,
I'm going to go way back in the back before I go around again, and then
Doctor, the Commercial Appeal is reporting that in the worst-case scenario, you were given data and information that 8,000 people could die, more than 400,000 people would be infected, and apparently you were given that presentation. Can you elaborate on that?
so actually, that particular data is from Dr. Jane, and so I will let him speak for himself. He's not here today, but we're more than happy to have him join us at some point. It's looking at predictions of what other communities have experienced as there's been increased spread and the number of seniors. We don't have as much information on chronic diseases, but that's worst case scenario. And there's a wide range of, we may not have a significant impact to an extreme significant impact, and it's really intended to prepare us for assisting hospitals in the event they need additional assistance. But I'll be happy to ask Dr. Jane to join us one day.
What are the trends you're seeing with the confirmed cases so far?
So as I said early on, it was directly related to travel. Individuals traveled to communities and then came home. And then once they came home, they got sick around day 5, which is the peak period. And then from there, they spread to their family members and close friends, and then to the workplace. And so that's still what we're seeing, not as much like broad community transmission where we don't see linkages to other people. There have been 1 or 2, which is a very small number, so you kind of draw a circle from that person out to the community. And what we're seeing is still within the family unit, social unit, and the workplace. So by implementing the broader stay-at-home strategy, it hopefully will confine that and slow down the spread.
So we're also getting a lot of emails from folks at home, and they're asking, they're saying that they hear about maybe someone in their office being tested, or that there's a confirmed case, but their employers aren't really implementing anything to make them feel safer. They're still going to work. So do you have any advice for employers listening?
Yes, that's a great question, and we get questions all day from employers. So when an individual is tested, they're immediately told to stay home until the test result comes back. When the test result comes back, in an ideal world, that healthcare provider notifies the patient and they notify the health department. As soon as the health department is notified, we work with that person to identify their contacts. We also reach out to their employer to identify contacts and determine who needs to be removed from the workplace and placed on quarantine. Where there's is a lot of anxiety, and understandably so, is a colleague may call in and say, I got tested, but it'll be 3 or 5 days before I know the answer, and people are real anxious in that time period. And so it really depends on the work environment. One is, I would say to employers, which was your fundamental question, is that realize this is very anxiety provoking for many people. This is new for us. We don't know how quickly it's spreading in some environments, so you have to appreciate as an employer the anxiety of your employees. The other is to make sure the environment remains clean, and that means extra, cleaning of desks, doors, elevators, all of those surfaces, but really demonstrating that there's action being taken to reduce transmission. There's things like work at home, the ability to get some of the employees out of the workplace and only have essential staff present is beneficial as well. If there's an EAP, obviously making that available to people. But ultimately, you can't release to other employees that someone tested positive or not. You can generally say someone was positive, but you can't tell who that person is. So it's about fundamentally getting information to the other employees in a timely manner, an accurate manner, without revealing confidentiality, if that makes sense. But it is very trying times because, again, we get calls all day and all evening, mostly from employers or coworkers. The other thing is there's a perception if, let's just say me, I'm exposed to somebody else. So I have to be quarantined. Somebody else in the workplace thinks they also have to be quarantined because they came in contact with me, and that's not accurate. So the only people that need to be isolated or quarantined is the actual case and people who came in direct contact. Other coworkers are really okay, unless for some reason that contact becomes ill.
Have there been any recoveries here, and what does it take for someone to fully recover?
So here, our early cases have recovered. Many of them have returned back to their activities of daily living. One of the things, though, that will happen over time as we have more spread, and particularly into vulnerable populations like seniors and those with chronic illnesses, it's going to take longer for them to recover, and we may also experience deaths. So again, we're trying to be aggressive early on.
And,
That's okay. We'll come back in.
In a relatively healthy person, the 14-period quarantine or isolation, over the course of that period, the virus runs its course, is that right? And it dies. That's normally the viral behavior, right? The virus. The fatality comes when complications result from respiratory distress. Maybe the person had COPD or some
yes.
heart disease or something, kidney failure.
Yes, so it is that when the person gets the virus, most people, about 80%, are going to recover without any problems. And then that other 20% may have more severe illness, and a very smaller percent, 3 to 5, may require hospitalization or may die as a result of the illness. And that is, as you noted, it's where people's respiratory system gets impacted and they have pneumonia.
What's your hope, realistic hope of these orders, the positive impact they could have in limiting the spread? Do you have any goals, thoughts of if things go as you hope?
So one of the things we look at in public health is what we call the Epi Curve. So how many cases you're going to have before you start to go down that curve. So our goal is to shorten the duration of the curve and to blunt the curve. So not to have as many cases and to reduce spread over time. But more importantly for me as a public health professional is to minimize deaths in our community. There's already deaths across the state, so trying to make sure that our most vulnerable populations are protected, and that means staying at home and staying away from those who are most vulnerable.
After,
There's been some
I'm going to come here, then I'll come back over here.
after you've had it, are you immune or can you recatch it?
So it's coronaviruses are similar to cold viruses, and as you know with colds, you can get them again. So there's a belief that there is some immunity for a short duration, but because this is a novel virus, we really have to study it over a year or more to see what the likelihood of recurrence is, particularly in a future year. And one more question back here. And
There's been some talk making the rounds today in the news cycle about, opening the economy back up in a few weeks, maybe around Easter. As a public health professional, do you think that's realistic, even here in our local community? I mean, will we be ready to be going back to doing even some business as usual in a few weeks' time?
So as I said yesterday, we would anticipate that you have to go through anywhere from 2 to 4 incubation cycles to see significant impact. So you're talking at least 4 weeks to 8 weeks before we begin to see that this particular efforts around staying at home or safer at home are going to have impact. So my personal opinion is that it would be difficult to return to normal within 2 weeks. However, keep in mind here, we're still early in our epidemic in Shelby County, and so by taking early aggressive action, we may shorten the time frame it takes to reduce spread.
Of those people that have recovered, are any of them being monitored for long-term effects that the disease may have?
Not by public health. Now that's something that might happen over time if there's a recognition that there are long-term impacts, but at the current time that's not the protocol. And individual healthcare providers can obviously monitor their clients.
Any concerns about the jail too on Poplar with this jailer now testing positive?
So many of you know inmate health actually falls under the health department. And so what I do know is that we had already taken extensive measures in partnership with the sheriff and his team, as well as with corrections and their team, to reduce the number of people who might come in and be COVID positive. Now that there is an individual within the system that has tested positive, our responsibility is to reduce contact as much as possible, identify the contacts, and quarantine them, just as I noted earlier, and we'll continue to do that and monitor.
And when did you find out that he was tested?
I don't have the exact dates about the test, and that information was put out in the public, and so that's information, as you know, I don't talk about specific individuals, that's just something that was already placed in the public, that's the only reason I'm addressing that.
I wanted to ask, and I don't know the level of interaction with the hospitals, but, a second employee at St. Jude tested positive for the virus, and we've seen a lot of people on our Facebook expressing concern about this. Obviously, everyone in that hospital is immunocompromised. Are you all involved in that at all? Could you talk about it? That's a real concern, how having a positive case inside that facility?
So the healthcare workers and the healthcare leaders meet in several different arenas. So there's been connection clearly with the health department and then also through the joint task force. Just this week we've had several meetings with healthcare executives as well as the chief medical officers. We've been also meeting with the community-based clinics and primary care providers. That's been myself and Dr. Jane as well as Dr. Randolph. I would just say more broadly is we should be very concerned when frontline essential workers test positive. So that's healthcare workers, that's jailers, that's sheriff's department staff, that's police and firemen for two reasons. One, they're going to have contact with vulnerable populations, but they're also the people that we need to have at work. And so it's important that we don't deplete our workforce because people are getting ill and passing it amongst each other, but then also to potentially their patients or to people who are incarcerated in any of our facilities. So yes, I have concern. I'll take one last question if there are any.
Are we progressing at about the level you thought would happen?
Probably, so the estimates are doubling every 5 to 7 days. Again, we had one batch come in that was 20-something at one night that were late coming in, so that made our numbers jump up. But we are where we would have expected given that doubling every 5 to 7 days. So again, that's a reason to take early and more aggressive action to reduce that from growing exponentially.
I think you said the lag in the numbers. So should we go with, like, if the state has a higher number or you have a higher number, should we go with the higher number?
Yeah.
Typically? Okay.
Yeah.
Just one thing.
Yeah. And again, what I think I'm going to try to do is work with Joan to adjust this time so that what we're reporting is after the state reports their numbers, but sometimes we actually get the reports here before the state does. So the higher number would be the more accurate number. And again, I appreciate everyone being here and getting the information out. We're going to work on the social distancing, so continue to be patient, but stay away. And then also, again, want to thank our sign language interpreter.